Hi, everyone. Welcome to the latest installment of our ongoing editorial webinar series, Coffee Talk. This hour-long information-packed episode organized by the hardworking folks at MedCloud Insider features the observations and insights of independent tech industry experts. Many thanks to the underwriting sponsor of this episode, Vation, provider of a cloud-native automation platform designed to help deliver automated print, output, and digital workflows that enable organizations to bridge the analog to digital divide. Without their support, this series would not be possible. And thanks to you for joining us. I'm John K. Waters, Editor-in-Chief in the Converge 360 Group of 1105 Media, and I'll be your moderator. Today's topic is hidden security risks of print in healthcare IT, and our lead presenter is technologist, creator of compelling content, and senior resultant Howard with the Tech Channel Partner Results Group. Sorry, Howard M. Cohen. But before we get started, just a bit of housekeeping. This episode is being recorded for later access. Keep an eye out for an email with a link to that recording. It will be coming your way in the next few days. We'll make some time during the talk for questions. Please feel free to type your questions into the Q&A box at any time. Our sponsors provide some extra resources you won't want to miss. They're available now on your console. And as a small thank you to the first 200 attendees who stick with us to the end, we'll be sending you a $5 gift certificate to Starbucks. It's a cup of joe to go with the info. Now, I'd like to tell you a bit more about our first presenter. Howard M. Cohen has spent more than 40 years in the IT industry. During that time, he has held senior executive positions in many of the top channel partner organizations, and he currently writes for and about IT and the IT channel. He's a sought-after speaker, an insightful observer of the technology landscape, and one of our favorite presenters. You guys are in for a great session. Take it away, Howard.
Thank you very much, John. I love that cup of joe with the info. Hello, everybody. I am Howard M. Cohen. If you'd like to keep up with what I'm thinking about and what I'm up to, please use the QR code at the bottom of the screen to subscribe to techchannelresults.blog. Today's topic, I have to credit our sponsor, the analog to bridging the analog to digital divide. I always thought that's just the only thing people were for, but so it goes. Okay, those of you who've been with me before know that I like to start with a word of the day. The word of the day today is turtle. Now, you may wonder, it's unlike any other word of the day that I can think of that I've ever done, but I thought turtle was a good word to start with because it puts me in mind of the challenge that we face. I'll explain what I mean. The fact of the matter is that healthcare as an industry has hurtled into the cloud. I mean, when you think about all the opportunities for healthcare that cloud technology represents, it's tremendous. And very, very quickly, we've seen things like file servers move over to cloud storage. They were embraced very readily. Email servers have moved over to cloud email. Even domain controllers have gone over to cloud identity management. So, I mean, we've seen example after example of healthcare appreciating and really taking full advantage of the opportunities that cloud-based technology represents in terms of being able to manage and move critical information from place to place to provide better and better healthcare. However, with all of this rapid movement into the future, there has been one laggard. There has been one thing that has remained behind, and that's what I'm referring to as our turtle, which is still sitting somewhere in the late 1980s, early 1990s. And that, of course, is printing in the healthcare environment. Frankly, printing in the healthcare environment is still way back in the distant past. And a part of the reason for it is because of what basically amounts to a false assumption. There's a false technical assumption that your print data, the data that you're actually printing, has to travel in parallel with your print management flow. And the fact of the matter is that that's simply not true. Those two roads can diverge in a yellow wood like this one. I'll give you an example. Microsoft Universal Print. Okay, Microsoft Universal Print says, okay, you're a hospital that is using Azure for your compute. You've got to move your data from one place to the other to print it. And then when you're done, move it back. And the question is why? Why must it move along with the management? Why can't they move separately? Why can't one move without the other? It's less exposure. And the fact of the matter is, when you think about the fact that what we're moving is more often than not protected health information, significantly protected with significant penalties for improper movement. You can't be moving PHI unless you absolutely have to. Another challenge that comes out of this is a challenge really that everybody else is facing, right? And that is the challenge presented by having data silos. Everybody's complaining. We have data silos. Our departments can't share data with each other. It takes more time than it should to get this done because you have to look for the data here, here, here. Oh my God, we've got to get rid of these silos. Well, the funny thing is, when it comes to healthcare, the healthcare industry loves its silos. Healthcare wants data silos, and there's a very good reason. Okay, first of all, they want to keep that protected health information in one silo, safe, tucked away, and protected. They want to keep electronic health records of all kinds, safe and protected. Their financial and billing data should be kept separate. Their human resource data, the skills and capabilities of all their people and who's assigned where. Diagnostic data for patients. They want to keep these things separate as they possibly can because they know that the more exposed they let them be, the likelier it is that they are going to fall out of compliance with HIPAA. Now, this is a spelling lesson right now. A lot of people still spell HIPAA, H-I-P-P-A, which is incorrect. And it's only because they don't know what it stands for. HIPAA is the Health Insurance Portability and Accountability Act. You can drop the first two and last letters and just focus in on portability and accountability. Portability, it means these rules regard how we move data from place to place when we need to. For example, from diagnostician to diagnostician, from doctor to healthcare facility, from first responder to hospital. I mean, there's all kinds of reasons where data, private protected health information, has to be transported from one place to another. It has to be made portable. But at all times, we must maintain accountability. That is, we can't let it get out into the open. Ever. Here's where the challenge arises. We talked about these different kinds of data that the healthcare organizations like to keep in their silos. Let's focus in on them. And I'll ask you, where is the one place where all of these have to go at some point or another? And of course, you've already intuited the answer. The answer is print servers. If you're going to print any of this, it's going to go to a print server. And that print server is going to take it to a printer and it's going to get printed. Okay. This being the print servers and printers, the one place that every kind of data comes out of its silo and has to go through to get where it's going, this makes print servers the one place cyber thieves, cyber criminals love most. Cyber criminals love print servers. They love printers because that's where they can enter into networks. That's where they can go get at the data that they want to help them make the money they want to have flying out of their computers like this guy does. Okay, just for stats, the obligatory stats, there were 725 healthcare data breaches reported in 2023, affecting over 133 million patient records. Okay, 61% of organizations experience data loss due to printing. Almost 2/3 printing. That's where the data losses occurred. Things and vulnerabilities like Print Nightmare use remote code execution within Windows Print Spooler. Anybody who's living in a Microsoft environment, they're using Windows Print Spooler. So they can achieve remote code execution through a product that you don't even think about using when you're using it. And more than 2/3 of enterprise printers have unpatched vulnerabilities. This, according to a study released by NIST last year. So it's a bigger problem than a lot of people think it is. It's a huge, huge problem confronting all of us. Now, lest you think it's a purely technical problem, let me point out that one of the primary problems is employee negligence. And this points out something important to remember about HIPAA. And that is that HIPAA doesn't just cover the technology. HIPAA rules include what people will do. People are very analog and prone to mistakes. They're forgetful. They're easily distracted. And they can do things that make data vulnerable. In fact, there were 176 million patients exposed to PHI breaches last year simply because somebody did something wrong somewhere along the line. And that's one of the reasons driving behind the existence of HIPAA, that we need rules to tell these people what they have to do. Once we have rules, we can hold them to them. So some of the security rule requirements include administrative, physical, and technical safeguards. No, not just technical, but administrative, physical, and technical, covering PHI. Documentation is also very important. A lot of people seem to forget that it's not enough to put a measure in place to accommodate a HIPAA rule. You have to document that what you put in place is working, that it is functional, it is successful. And so with all the rules that are out there, you have to document that you are obeying those rules successfully. You also have to be safeguarding against potential threats coming at you. And you interpret that as threat hunting. But you have to have things in place to make sure that people and that technologies are being very, very careful in their dealings with PHI. There are some print-specific compliance challenges. Most print jobs travel unencrypted. If I were to ask all of you, how many of you know that your print jobs are encrypted? I doubt I would see many hands. If I'm wrong, boy, I'd love to learn that, but I truly believe that nobody really thinks about that. Here's one of my favorites. You're sitting at your desk. You have some diagnostic information. It is PHI without a question, but you need to print it because you want to sit down and share it with somebody and discuss it. So you click print, and then the phone rings, or somebody comes in to visit you, or you spill a cup of coffee, or any one of a million other things happens and you get distracted. And the day goes on, and you never went and you picked up that print from the print tray. This is very similar to something that we've all experienced at one time or another with a fax machine. You never know when a fax comes in. People don't call you and say, hey, I just sent you a fax. And it may happen sometimes. It's incidental. It's not typical. So a fax comes in, it falls into the basket and sits there along with all the other faxes that fell into the basket. And if there happens to be a cyber criminal wandering around the halls of a hospital and they happen to get close to a fax machine, they may find a treasure trove of data sitting in that basket. Also, there's no audit trail. You never know that nobody necessarily ever knows that you printed a sensitive document. There's no audit trail unless you make sure that there is an audit trail. So these are HIPAA's print-specific compliance challenges that we all need to think very, very carefully about and plan for. There are some traditional risks inherent in print servers themselves. Okay, they are single points of failure that can compromise entire networks in many, many different ways. Much more vulnerable than most people think. Usually, users have to have, not usually, frequently, users have to have elevated system privileges to be able to use the print spooler. Those privileges may give them access to other things that they really don't need access to. And some network administrators are, I'm sorry, lazy. They'll issue elevated system privileges to everybody to make sure nobody ever calls them complaining they can't print. Also, there are still some legacy protocols used in the printing function that can't be updated to accommodate modern security controls. They are simply out of date. And in most cases, drivers are being managed manually. There's no automation involved there. These create security gaps as well. Not only are the printers themselves vulnerable, but they expose the network too. I mentioned Print Nightmare before. It exploits TCP ports 445 and 135, and anybody who's ever configured a network, you've seen those ports go by. They're very frequently used ports, so that's dangerous. They also often have broad network access. Not only do the users have more rights than they should, the printers do. The printers themselves. There have been noted cases of firmware in printers that have vulnerabilities which allow a cyber criminal penetrating to go laterally within the network. This is one of the most horrifying things that those of us in cybersecurity think about, is that once somebody's in, where do they go besides where they entered? They have east-west movement in many cases. So that is something that has caused more havoc than most anything else we can think about. So network exposure from print servers is a tremendous issue. We've looked at the vulnerabilities, just some of them, but I think what we've emphasized is that there are many. There are many vulnerabilities. They all have to be considered. Many of them are covered. I mean, not for nothing. I've said this more than once. The best way to make sure that you're compliant with the HIPAA Act is to start by reading the HIPAA Act. It's a dry read. I'll guarantee you that. But it exposes many, many things that you may not think about heading in. Obviously, hiring somebody who's done it a million times to come in and help you with that, that's probably a very good idea. But if you're going to have your own IT department handle it, make sure that they familiarize themselves with the HIPAA Act and with the latest version of the HIPAA Act. Now, however, let's turn to the role of print. Not for nothing, but everything that happens in a healthcare organization happens to improve patient care. And so what are the issues surrounding print as it regards patient care? Well, first of all, there is a constant flow of help desk tickets for printer connectivity and driver issues. Let's face it, and you're going to hear me say this a couple of times in the next few seconds. Printers are mechanical devices. Yeah, you can tell me it's an inkjet printer, it's a laserjet printer. They're still mechanical devices. However you're putting the image on the page still has to be pulled through the device. So there are many, many mechanical parts in there. It's easy for them to wear down, especially with the volume you think about having in a healthcare environment. Nothing survives for long in a healthcare environment. It's a very rugged environment where a lot is going on all the time. Everybody's moving very quickly. It's very demanding upon the people. It's very demanding on technology too. So there's going to be a constant flow of help desk tickets for printer connectivity and driver issues. Print server maintenance, again, a mechanical device, has to be maintained on a regular basis, has to be repaired on a regular basis. It's going to inevitably disrupt clinical workflows because the printer is not available for use during the time that it's being repaired. Manual printer deployments will always cause delays. It takes a while to put a printer into place to get it to work. It also takes time to replace the toner cartridge or the inkjet cartridges or the other consumables, paper, for example, in a printer. The worst thing in the world is that you have to bring a doctor an image of something that he's using to diagnose a patient, and the printers have paper. And, oh, look, there's no paper in the cabinet. You get the idea. It's very easy for manual functions that surround printing to cause tremendous delays. And they're not that easy to troubleshoot. You're not going to have an orderly or nurse or a doctor or anybody on the floor troubleshooting a printer when it goes down. You're calling somebody from IT And if there's somebody available, it's still going to take them time to get there. So there are delays engendered in literally everything having to do with printing. So what are the impacts of some of these things? One that absolutely scares me when I think about it is the delay of lab results and prescription processing. Not so much, I mean, okay, we all have been in a hospital or been in a doctor's office or been in some healthcare facility at some time where we had labs done. And usually the labs get done in a day or two, and that's okay. And if it's delayed another day, well, hopefully we got to the lab in enough time that when they get the results back, that's when we go see the doctor. But when you're in a hospital situation, especially an emergency room situation, where the lab results need to be rushed, and you're going to deliver them to somebody on an emergency room floor who doesn't have a tablet with them or is not near one of the rolling carts, and you're not going to show them where those results are, you're going to print it and you're going to run it to them. That result, that delay, could be the difference between life and death. Same with prescription processing. If a patient needs medication immediately, and part of that requires a piece of paper to document the prescription, I'd rather see us disobey that rule and get the medication where it needs to be, but not every administrator is going to be that way. So the fact that the printer didn't do what it had to do and that could impact a patient outcome frightens me. Clinical documentation workflows. In many cases, healthcare issues involve a multiple disciplines. And in many cases, the information is being shared by people who depend upon paper to look at the clinical information they need to study and share with each other. So the actual workflow of patient care can be significantly delayed by the inability of a printer to fulfill its requirements. I mentioned it a moment ago, I'll point it out again. The emergency department is probably the easiest place to see the impact most vividly. Things have to happen faster there. Things have to happen, in many cases, instantly there. Anybody who's ever been in an emergency room for an injury knows what I'm talking about. Your patient is scared out of their wits, and they want answers. And you want to give them answers to calm them. And you need those answers to cure them. So in many cases, if something's got to be printed for you to look at it, that's a significant impact. This also adds administrative burden, not only on clinical staff, but on everybody. And most healthcare facilities today are already understaffed. So you don't want to place any additional burdens on them. Okay, so we've talked about what's going on right now, and we've talked about what's been going on for the past 30 years. Let's swing our view around and take a look toward the future. Because HIPAA is preparing to introduce new regulations to future-proof healthcare computing in many important ways. They know, for example, that the security landscape is evolving. They're finding new vulnerabilities every day. Remember, those cyber criminals that are out there sitting in their basement, bug-eyed till 4 o'clock in the morning, they're coming up with ways to penetrate through printers almost 2/3 of the time. We saw that before. This means that, yes, Health and Human Services will be increasing regulatory scrutiny of the cybersecurity practices of healthcare organizations. You can be guaranteed, if you felt HIPAA was stringent yesterday, just wait for tomorrow. Think fines, think increased fines, think personal fines, not fun stuff. The attacks that those cyber criminals are creating are growing in sophistication all the time. Not for nothing, but AI has become very popular, and cyber criminals know better than anybody how to apply it productively for what they want to accomplish. You can also expect to see expanding definitions within both covered entities and business associates. If you are any kind of business that services the healthcare industry, you can expect there are going to be more demands put upon you, especially as regards printing. We still see a lot of data exchange happening on paper. That hasn't gone away. It's not going away. So expect to see more and more stringent requirements in the upcoming versions of HIPAA. There are also concerns with the fact that the legacy infrastructure is very limited. It can't adapt to new requirements. There's going to be new requirements. That doesn't mean that suddenly all of the infrastructure hardware improves. It's going to have to be improved. You're still dependent on vendor patches. If we find an exposure and you have to fix it, but you can't fix it without a patch from your vendor, you're going to be very, very involved in hammering that vendor to come up with that patch. That's not a posture anybody wants to be in. So you can bet that HHS is going to be turning to vendors to accelerate their processes regarding distribution of patches. If you thought that the documentation requirements were complex before, it's only going to get worse because there's more to be documented. And one of the things that we're seeing that raises my hopefulness is, again, AI, right? Automation. Many vendors are looking at ways to apply automation to the documentation processes so as to facilitate them, because you know better than me, people don't like to document. They simply don't. They got the job done. They're happy. Oh, now I have to sit down and document it? It's a problem. It's always been a problem. It'll always be a problem. The more automation we can apply to it, the better off we all are. And we still have very limited visibility into print security events. We've developed all kinds of visibility because nothing in cybersecurity protection is more important than visibility. If you can't see it, you can't protect against it. It's like the Karate Kid. If a man can't walk, he cannot fight. Anyway, if you can't see it, you can expect that there's going to be more demands for visibility in the print workflow. So this brings us to the bottom line. What do we need to give our healthcare teams? And what do we need to give to our healthcare IT teams? We need to give them the technologies that make it easier for them to deliver the best possible patient outcomes. And it's very easy to remember that. That's a very easy goal to remember at all times. Hopefully, what you're going to see after my question and answer session will get you a whole lot closer to feeling really good about your ability to provide your healthcare IT teams with exactly what they need. With that, John, do we have any questions?
We do. Thank you, Howard. We'll get to our first Q&A now. Remember, folks, you can type your questions into the Q&A box at any time. We'll do our very best to get to all of them. Let's look at this. First one is from Ash, who's wondering, can cyber criminals really penetrate a network through a printer?
Yes. One of the most vulnerable protocols is SNMP, Simple Network Management Protocol. SNMP provides a MIB, a management information base, that is built into the firmware of just about every product that sits on a network, including printers. I would venture a guess, and it's really only a guess because I've never studied it, that the MIB inside of a printer gets less attention than the MIB inside of any other device made. So there are all manner of ways in which cyber criminals can exploit SNMP, especially because SNMP is one of the last things to get updated. There's some earlier versions of SNMP that are startlingly vulnerable, that use plain text to pass along passwords and other critical protective information. So we've seen it for years. And hey, listen, when it comes to servers, file servers, when it comes to other communication devices, the SNMP protection in there is stellar. But I would say that printers have gotten less attention over the years than any of those other devices, because I think the manufacturers lack imagination. They can't imagine cyber criminals invading through printers, just like the person who asked this question couldn't imagine people invading through printers. Well, they can, and they do.
Okay, here's one from Mal, who's wondering, don't you think print is really disappearing and being replaced by tablets? We're kind of talking about this before the seminar.
Yeah, I was about to say that, you mentioned the introduction of the iPad just a few years ago. And my point, you mentioned that I'm a senior resultant. Resultant means I'm all focused on results. The senior part means I'm old. And I'm old enough to remember 1966 watching Star Trek and watching all these people handing these little tablets to each other with information on them. I never saw, there was one episode actually where they were using paper and it had the corners cut off so it looked like alien paper. That was kind of clever. But otherwise, they used tablets to hand information to each other, physically hand it to each other when they were sitting in a room together. There was no paper. You think about every conference table, every desk, everything. Think about every scene in any Star Trek episode of any movie or series. There's no paper. So a lot of people think that paper is passé and we're all going to move to just exchanging data over tablet. That may happen. I have to tell you, it hasn't happened yet. I walk into into office after office that are piled high with papers all over the place. And I get it. I once interviewed a bank in Bosnia and asked them why it is that they have so much focus on printing. And they explained that they were the only company in the country that had digitized. Every other company did everything on paper. And that was only a few years ago. So today is not the day of getting rid of paper, but maybe someday.
Okay, we've got one more question from Lee, who's wondering, are cloud-based email servers and identity management HIPAA compliant?
No. I can say that categorically. I love questions like that. I look forward to questions like that. There's a fallacy that is very popular that everybody would be very well served to put out of their minds. Okay, you can look at every printer made. You can look at every server made. You can look at every device made. I guarantee you that none of them are certified HIPAA compliant, because that's not how HIPAA works. It's not that any of them are good, bad, or indifferent. It's that that's not how HIPAA works. HIPAA does not certify products. You, the client, have to be HIPAA certified. They have to certify your organization, your function, as being compliant with HIPAA regulations. Now, there are products that help you achieve HIPAA compliance, and there are products that don't help you, and there are actually products that hinder you. But the products themselves, no, they're not HIPAA compliant. If a product enables you to perform your function, here's that analog to digital conversion that Vasion talks about. If the digital device enables the analog human beings in the organization to do what they must do to comply with HIPAA regulations, then that's good. That's what you look for. And so, yes, there are printers and there are servers and there are print servers and there are cameras and microphones and you name it that will help you achieve HIPAA compliance. And there are those that just don't.
Okay, Howard, thanks very much. Now let's get to I'd like to introduce our second speaker, I should say. Steve Kelly is the Director of Public Sector Group at Vasion, and he's joining us now via webcam. Take it away, Steve.
Yeah, thank you, John. And wow, thank you, Howard. I really appreciate just the expertise and the industry, the way the industry is looking at print. We've been trying here to articulate and get our customers to think about printing not just as an afterthought, but think of it as the way it was just articulated. How does it have an impact operationally and from a security perspective? And it's one of the things that drew me here to Vasion. So to introduce myself and my role, I've been here at Vasion for 10 years now. I did start as a system administrator, and then moved into a system engineer role, and then now directing the public sector and regulated teams. So it gives me an opportunity not only to work with healthcare organizations, but other highly regulated environments like state, local, and federal agencies. I'm going to go ahead and turn off my camera, keep everybody focused here on the slides. But what I'd like to dive a little bit deeper into is go over the legacy approach to printing. The legacy approach to managing printing is exactly as Howard described, which was I had that central print server because that gives me a single place as an IT administrator to log into and update my drivers, make my printer deployment assignments, and have some level of auditing and visibility. But there's a trade-off of that approach that IT organizations have just felt like they've had to compromise with. And that trade-off is it was a single point of failure. And it is Howard just articulated, also a single point of vulnerability. I love the analogy he used with data silos. Data silos, from a security perspective, are very convenient. And when that may have been the desire, print servers broke down that paradigm. If I'm somebody who wants to do evil, or I want to attack a network, we can all now quickly imagine how appealing a print server centrally located is. I now have access to patient records, prescriptions, HR documents, financials. And so it will always be a target for a attacker to try to gain access and exploit. Now, organizations who have realized that have tried to step into the distributed print server environment. They thought, okay, if I can take that one print server and now replicate it into, let's say, 12 print servers, then if one of them is exposed or attacked, I only have 1/12 of my environment exposed. Again, you can hear there's a trade-off. I'm trade-off by reducing my attack surface, but now I have more to manage and maintain from an IT perspective. Now, I couldn't agree more with how vendors in the print environment have neglected printing from a security standpoint for decades. The S&MP vulnerabilities that Howard described are ones that we are actually trying to solve with the US government, who are seeing that one of the highest areas of vulnerability is the print environment. Now, the question I love to get people to think about is like, why? Why have we put up with print servers, and why are we making these trade-offs? And the simple answer has been because they feel like there hasn't been a good alternative. Now, if you're not familiar with Vasion, you may be familiar with our old company name, which is Printer Logic. We are the same. We did rebrand, and I'll give some explanation to that here in a moment. But we entered the market 15 years ago with one sole purpose in life. And that sole purpose was to eliminate the dependency and the trade-offs of IT organizations using print servers. Now, since then, we've helped 13,000 customers manage their printers without a single print server. Last year alone, we helped those customers manage and gain visibility into 2.9 billion records, 2.9 billion print jobs. And we maintain, even after 15 years, a 95% customer retention rate. Now, why these statistics really mean something important to us is because it highlights to us that we are solving real-world IT problems. It's not just fancy widgets and dashboards that show a story in a pretty way, but does solve real-world operational and security concerns that all these IT teams are being demanded to address. Now, as I mentioned, you may have heard of us in the past as Printer Logic. We have since rebranded to Vasion. And the reason is we've extended beyond just the front office print environment. We now offer 3 solutions on top of what we call the Vasion automation platform. The first one being the one that most of you are familiar with, which is Vasion Print, or formerly known as Printer Logic. This is our solution that offers a secure serverless printing solution that eliminates those print servers I described. It streamlines the deployment of print devices to your end users, and it removes the headache around driver management, update, and patching. Vasion Output is one of our newest products that allows us to extend all of those benefits of a serverless print environment, but brings it to the back office environment where systems like Epic, Cerner, SAP, and Salesforce, or other areas where there are mission critical print documents being generated not by end users, but back office systems, and they are paramount that they get to their destination. Now, our traditional driver management self-service portal did great for the front office environment, but what happens now when an Epic system needs to print a document to a printer that's no longer online? I loved how Howard teed up the impact to a patient where it may literally be life and death if they don't get that prescription or information printed in time. And so to bring stability to that print environment, with our Vasion Output solution, we now have the ability to do things like rule-based routing, high available printing pools, and extend those benefits even to things like label printers that were traditionally not in scope. Our third product that we have recently announced is Vasion Automate. Vasion Automate allows you to digitize forms, deliver digital signatures, and build smart workflows that streamline both operations while on top of reducing your dependency on paper-based processes. I love the question that came in earlier of, isn't printing on its way out? Aren't we going to a digital-only or tablet-based world? And being a company who manages printing today may see that as a threat, but we actually are excited about that future as well. I agree with Howard. I think it is a long ways off, but we want to be an enabler of organizations that are tired of printing and they want to be able to migrate to a digital-only process. We love the term that we've coined, which is bridging the digital to analog divide. How do you create a workflow process when a document may need to be scanned in, going from analog to digital, or where some data needs to go back from digital to analog, like printing out a label for a wristband? This is a traditional area where workflow and automation has just left the area unaddressed. And with our Automate platform and our unique position in both seeing the physical paper world and the digital workflow world, we can create and streamline operations in ways that other organizations aren't able. Now let's get back to the here and now. So Vasion Print, a modern solution to old problems. As I mentioned, we eliminate the need for print servers. But while we do that, we still maintain print data encrypted both in transit and at rest. So reducing that attack surface by eliminating the print server, but even if somebody were able to intercept that print data, it is unreadable and unusable, making it not an appealing target. Now, this allowed us to deploy also a zero trust architecture. This is something we're really proud of over here at Vasion because as far as we know, we are the only print solution out there that has a true end-to-end zero trust architecture. That means we authenticate and secure every print interaction every time. Doesn't matter if it came from a BYOD device or a guest device off an untrusted network, even coming from something like a Starbucks cafe. Or if it is on your network and you still want the validation that that is coming from an authenticated source. We've also eliminated the idea of a central print spooler, meaning you no longer have that appealing attack vector, that one central point that hackers are targeting to gain access to all of those all those data silos. I'm going to double tap here the real world threat. The print nightmare vulnerability, if you're an IT administrator, you remember the headache that caused in 2021. The remediation for this, is, when it was posted as a 0-day attack, was immediately turn off your print servers until Microsoft could release a patch. It took about 4 to 5 days. It took 2 or 3 rounds of patches to fully remediate it. And even after the vulnerability was patched, it left a lot of system administrators dealing with, now my users are requested for admin credentials or authentication every time they need to install a new printer. Now, one thing that we're really proud of, again, at Vasion is during 2021, we had a lot of customers, of course, reaching out to us and asking us, hey, we're a Vasion Print customer. Are we impacted? And the answer is no. We had 0 customers impacted by Print Nightmare because we don't have a central spooler. Now, as I mentioned, that was Vasion Print, and we wanted to bring that security posture beyond just users who are printing from Word or email or their desktop and extend it in to document delivery or for jobs who are printing from back office systems like EHRs or ERPs. It's still built on that true serverless print environment, meaning even though you may have a hosted ERP or an EHR system, we don't offer up a central spooling service to ingest those jobs from that EHR before routing them on, keeping that low attack surface even when you're scoping in your back office solutions. On top of that, we've also delivered the ability to secure the physical print job itself as well. Now, this is one of the areas where security gets very concerned with, because when data transitions to a physical paper, you lose all control or ability to protect that document. We can easily imagine a prescription that was printed, of course, that is only authorized for one patient. But if it's left there on a paper tray, anybody who has access to that paper tray can pick it up and walk away with it. So we have delivered the ability, even without a print server, to allow users to print documents and have them not print out to the physical printer until the authorized user walks up, types in a PIN, taps their badge, types in a PIN code, uses a Vasion app, a mobile app to release that job, ensuring that that physical document only gets picked up by the authorized user. A common request that we saw over the last couple of years, specifically from the healthcare environment, was, can we enable that physical security, but allow more than one authorized user to pick up the same document? A very easy use case. A doctor prints a prescription, but we want the nurse or the checkout staff to be able to pick up that document to give to the patient. So we have just recently released delegated release. This allows multiple authorized users to be able to print and release jobs on each other's behalf. And again, I love the articulation on Howard. I can't tell you how many conversations I have had when customers ask us, are you HIPAA compliant? And we have to walk them through, the solution isn't HIPAA compliant, it's your processes that have to be HIPAA compliant. And we are an enabler of that. Now, part of that enablement is we have full audit and tracking of every print job, no matter who printed it, who picked it up, and when it was printed out, and which device it was printed to. Now, that kind of sounds like an obvious statement for most print solution providers, but it's not. You can easily see where auditing and visibility quickly break down. If you have a multi-print environment with devices from HP or Ricoh and Toshiba, each of those solution providers may have auditing into their manufacturer, but what happens when you have multiple manufacturers inside the same network? Now, one of the things we love here about Vasion Print is our auditing trail covers no matter who printed or where it went out, and doesn't rely on the SNMP protocol. Now, these are, as I mentioned, are real-world impacts. We survey our customers twice a year, and one of the statistics that has consistently come back is how much we help reduce the operational cost to manage printing. 90% reduction in print-related tickets. On average, most of our customers will see one print-related ticket per user per year. So if you're an organization with 10,000 end users, it's quickly and easily you can quickly see how you can get to that 10,000 help desk tickets very quickly. Another thing I love to ask people to do is, don't take our word for it, go to Reddit. Reddit is a great place to see how our customers are talking about us, not how Steve in a sales pitch is talking about the solution himself. Before we turn it over to Q&A, I'm just going to highlight one of our most recent real-world use cases, which is Kingston Healthcare. Now, this is an organization that has over 14 senior living communities and rehabilitation centers who were recorded printing nearly 300,000 pages every single month. So heavily dependent on printing. After print 9 years, they realized that print servers were just not something they were willing to compromise with anymore, especially with the security risks they introduced. So by switching to print, Vasion Print, they eliminated all 15 servers, and they reduced not only their attack service, but also a cost savings over $70,000 annually on hardware, maintenance cost, and those high-T help desk tickets that were generated. After rolling out Vasion Print 6 months later, they reported 0 print-related help desk tickets. And it's really hard to imagine how we could reduce help desk tickets that much. We'd love to show off our self-service portal. Most print-related help desk tickets are just users simply needing a printer installed. Traditionally, that has required IT administrator to remote in or create a login script or a GPO with the admin credentials to deploy the driver and define that printer in a way that the end user isn't familiar with. Most users don't know what a print driver is or an IP address. And so with something like a self-service portal that Vasion Print introduces, end users get presented a simple map where they click a printer. We use system level credentials to install that for them, and they simply click File Print. One of the greatest areas of reducing your print costs and your IT burden. So a lot of great information, hopefully tying really well into Howard and the way that the industry is looking at printers and print servers and the vulnerabilities that they introduce. So I think now I'm going to go ahead and open up our Q&A inbox real quick. And I see, let's see here. A good question. Okay, sorry, getting familiar with the interface. It's asking what type of, or what makes you different from any other print management provider? The easiest way to answer that is a lot of print solution providers who did see opportunity to improve the print environment tried to do it on top of a print server. They simply just took one of those problems that I highlighted, like the auditing and visibility piece, and said, why don't we just create an audit solution that installs on top of the print server? Well, they didn't solve all the other problems of the operational overload or the security vulnerabilities, and you still had a single point of failure with that print server, or you had distributed servers that you had to manage. So what truly makes us different is we are a serverless print solution where we separate the management of printing from the actual print traffic itself. IT administrators define printers, the drivers, they deploy the printers out to their end users. But when a user clicks File Print, it's going to go from that workstation directly to the printer. So we don't have access to that data, which is great from a PHI and HIPAA compliancy perspective, but also means if we go offline or our service wasn't available or couldn't be connected to, printing is still successful. The other main differentiator of our solution is we are a true multi-tenant SaaS-based solution. So you aren't worried about maintaining infrastructure inside your environment to maintain printing. All right, so I got another question here is, so is Vasion a competitor to Microsoft Universal Print? I love that question, Ulysses, thank you. Yes, frankly, we would compete against them, but we feel like there's not much competition when you start peeling back the layers. If you look at migrating to Universal Print, you're going to see a couple trade-offs. Yes, you get rid of your print server, but Universal Print doesn't support things like secure pull printing. So now I have the ability to eliminate a print server, but how do I protect the physical document on the print server itself? It also doesn't extend to the back office environment. Universal Print just isn't able to intercept and manage print jobs coming from Cerner or Epic or another back office system. At Vasion Print, we develop a solution that is a platform. We use that language very intentionally because we want any print need to be addressed in our solution, not just the front office. And now I have to go find something separate for my back office. So great question. Here's another one. How does Vasion Print work with a multi-site or a large healthcare system? Have the IT teams spread out? This is our bread and butter. We do work with small sites as locations that have 5 printers in one location. 2 of our largest customers today are the 2 largest healthcare organizations in the entire world. I'm not going to name them, but you would be able to identify them pretty quickly. And in fact, I think I saw one of them here on the call today. But we are able to manage hundreds of thousands of printers for an individual site across hundreds of different locations. And we're able to do that because of the SaaS-based nature. All of those IT administrators have one single location that they're able to log into where they have role-based access control. So if I am responsible for one hospital and one site in a global organization, I only see and access those printers. It's the same thing with our end users. As our end users need access to self-install a printer, they only see and access this information pertinent to their site and their user group. Here's, one more question, unless I see another come in. How does Vasion Print integrate with existing EHR or EMR systems? Yeah, really good question. So this gets really technical, and I love when our technical experts, our system engineers, can get in here and get to the bits and bytes of how we do this. But at a very high level, we are able to use an external gateway that allows you to connect something like a hosted EHR system that's in the cloud. And over port 443 and using that zero trust architecture, we're able to authenticate from your network, pull a print job down through your firewall without any outbound connection. So this doesn't require your security teams to open up firewall ports and trust that the information that's coming through them is authorized, but rather we pull it down, originating from inside your network, and then we don't allow that tunnel to open and pull that EHR document until we have validated not only the tunnel, but the certificate around that print job as well. We also include full audit and visibility. Other print solution providers, when they say that, they're meaning, hey, IT team, if you want to see who printed what, go to your system event viewer or Windows event log and try to scroll through and see who printed what. That has traditionally worked for end user printing, but if you were to go and look at an EHR system printing through a print server, you're going to be familiar with it. It's just going to show system. It's not going to show the actual end user that printed or originated that job. That's one area that we provide HIPAA compliance and additional value by not only seeing and ingesting jobs from EHRs, but tracking back to the end user that originated that document and auditing against the user. So really good question. I also get a question like, well, what EHR systems do you support? Of course, the big ones, Epic, Cerner, Meditech, but even those non-name brand EHR systems, we can integrate through APIs and standard printing protocols to really integrate with any print system that is out there. So with that, I think that leaves 3 minutes. Man, I couldn't have timed that better. That was a great finish. With that, Howard and John.
Thanks, Steve. And that's all the time we have for this episode of Coffee Talk. Many thanks to Howard M. Cohen for an insightful presentation and to Steve Kelly for joining us on this informative episode. And a special thanks to Vasion for sponsoring us. We couldn't have done it without them.